Okay, so good afternoon, everyone. Hopefully you can hear and see us today. Hope you're all doing well. My name is Charmaine Jackson, and I head up the training team for Ardens, and also joined by my colleague Mariette Hadfield, who is one of our training specialists who covers the Southwest region. We've also got Georgina Ford on the line today, who is one of our team leaders who works for the Ardens manager support team. So between us, what we're going to be doing today is walking you through how Ardens can support you with risk stratification. So hopefully you're all on the right webinar. It's a big topic right now, as we know, hence why you are all here. We're expecting quite a few of you today. This is a repeat. So we did the same webinar about 2 weeks ago now, even maybe last week. It's so busy at the moment, but we did do this webinar, so it's just a repeat of that content just to make sure that everyone is happy with what we're doing and how we're supporting you. Now, things may look different in each area, but please note that this webinar is open to absolutely everyone. So it doesn't matter if you're working for a GP practice, a PCN or an ICB, or whether you're using EMIS Web or System 1. We're going to be covering all of our resources today, including our Ardens Manager platform. Now, in terms of housekeeping, just to make sure you are getting the most out of this webinar, you're not connected to a camera or a microphone. If you do have any questions that you would like to answer, then please do. No question is a silly question, so fire your questions away. Make sure you know where your Q&A option is and you're familiar with that. While you're there, you may also find the pop-out option quite useful too. But what that does is it allows you to see the screen that we're sharing in full screen, and it takes away all of the initials and the cameras so you can focus on what we're demonstrating today. I've already mentioned that we've got myself here, we've got Mariette, we've got Georgina here. We'll all be answering the questions in the chat. We'll also break up from time to time to discuss those questions verbally. At the end of the webinar, you will also have some time to verbally answer your question if you prefer as well. So hang around if you want to do that. Now, this session is going to be scheduled for an hour. We try and keep to that as much as possible, but it does depend on how many questions that you do have. And the session will be recorded, so don't worry about having to take loads and loads of notes. We will make sure the recording goes out to everyone that has registered today, and it will also go on our website as well. So that's the housekeeping. In terms of what we are covering, the majority of what we're covering today is risk stratification. So we're going to be starting with the why. Why do we have to do this? We're then going to follow that by the current challenges. We're then going to talk about how we at Ardens can help you. We're then going to do a live demonstration so you know exactly how to find our tools and use our tools. And at the end of the session, we're going to discuss the next steps and where you go from here. Please note that the majority of the session will be on Ardens Manager today. In order to use what we show you, you have to be an Ardens Manager subscriber, but don't worry, we will fill you in on how you can log in if you're an existing person and how you can sign up if you are on a trial. And we will touch on some of the clinical resources at the end of the session too. Now, risk stratification and the why for risk stratification. Now, I'm sure that you are fully aware now that risk stratification is a process of grouping patients together depending on how healthy or unhealthy they are. And it focuses on areas such as disease progression, the likelihood of hospital admissions, or attendance to an emergency care setting. Now, this is all great in an ideal world, but the trouble is, as we know, there is a rising demand for this, and patients are arriving at all different times with all different complex needs, which means when it comes to us identifying those patients and then understanding exactly what they need, it can be quite challenging as our population does grow. So by risk stratifying, what we're doing is we're moving from a reactive approach to a more proactive approach. So that will see us have more early interventions for high-risk patients. It will also see more targeted interventions and making sure that they're timely throughout the year as well. It will also help us streamline our resources. So are we using the right staff for the right patient care throughout the year as well? It will reduce hospital admissions, and like we know, as part of the NHS England's plan, that's one of the main things why they're doing this. And ultimately, it's going to provide even better patient care for our patients. Now, we do recognise, like anything that's new that comes in, we recognise that there are challenges for you, particularly in this area. And we know that it is part of the network contract DES requirements for this financial year. So you can see parts of the guidance that we've put some screenshots on the slide here. It does state that you must be risk stratifying your patients, and you also must be using a data-driven approach to improve health outcomes. And that's where Ardens comes in. And we also know that it is also part of CAPE funding as well. Remember, we can share all of this information with you after the webinar. But despite all of this guidance, a lot of us may be interpreting this in different ways, hence why we may be doing it in different ways. We know that there's also complexity around the model as well. It really heavily relies on coding. If coding is incorrect or if data is completely missing from the system, it's going to be really hard for us to categorize patients in these following groups. So this is where we at Ardens are going to help you. We're going to help you risk stratify across your whole population. And Mariette's going to show you how to do that shortly. We're also going to do it by long-term condition. We're also going to do it by other segmentations. Maybe you want to segment patients by demographics or maybe deprivation. And we're also going to help you with continuity of care if you're adapting that within your organisation as well. And we will show you the resources that we have on that today. Now, we cover the most common risk stratification tools, which again, we will show you each of these shortly. Some of you may have adapted this already. In a minute, we're going to answer you some poll questions to understand what you are using and what you're not using. But we cover Bridges to Health. We cover continuity of care. I've mentioned that already. We cover Johns Hopkins, UCLP, Q Risk Free, Q Admissions, and also Q Cancer. And anyone that is using the Cambridge multi-morbidity score, we'll soon be helping you with that as well. So we're hoping we captured quite a lot of the risk stratification tools that you're using. But if you are using something else, it'd be really interesting to know shortly if you are and what that is. I also mentioned about other segmentations as well. So we break down by age, gender, ethnicity on all of our reports, break down by conditions, and also deprivation, which Mariette will show you shortly as well. So hopefully that just kind of gives you a bit of a background on risk stratification, why we have to do it, what the challenges are. We are now going to show you exactly how we can help you. But before we do that, and while Mariette is switching over to her screen, I am going to launch some poll questions, if that's okay. So just watch out on the front of your screen. You'll soon get some poll questions come up. Just bear with me. So the first question we want to understand is whether or not you've embedded risk stratification as part of your workflow. So I'm just launching that question now. You've got the option to say yes, no, or not sure, and then we should hopefully all be able to see what the responses are. Thank you very much to those that are responding. We've got nearly 300 people on this call, so it'd be good to see what the results are. Looks quite balanced at the moment, doesn't it, Mariette?
Yeah, very.
Fine. It's
Almost
really balanced across the three. Okay, so at the moment we've had over 200 responses. Thank you. 35% of you have adapted it. Be interesting to know what you're using. 30% said no, you haven't done it yet, which is fine. That's why you're here. And 36% say that you're not sure. That's fine. That's why you're here as well. So next question we want to understand is if you have embedded it, what are you currently using? If you're using something else, specify that on the Q&A. If you're not using anything at all, then just click on none, and that will just give us an idea of what you're using. I must say, was it last time? Was it continuity of care that people were using most last time? Or was it, no, it was Q Risk Free that people were using this time, wasn't it?
Yeah, it was one of those two.
Yeah.
So quite a few are using none.
Yeah, which is fine. Fine, so quite a few are using none. So that gives us a good idea. Thank you very much. Right, I'm going to pass you over to Mariette now, who's going to give you live demonstrations. So over to you, Mariette.
Lovely. Thank you, Charmaine, and good afternoon, everyone. So we're going to start off in our Ardens Manager here, and the first thing that we're going to look at is population level risk stratification. So this is a really good starting point unless you already have a specific project in mind. So where we're going to start off, if you use your menu along the left hand side here to go to your services dashboard, and we're going to focus on population. Now on here, as you can see, you've got lots of different population insights here from age groups, genders, all sorts of things, but we're going to go along the tabs here at the top straight to the risk stratification section. Now this is where you will find all of the registers for the various different risk tools that we've got. Working our way down the list here, so as you can see from the very top, we've got something called Bridges to Health. So this is a population segmentation model that groups patients based on combinations of long-term conditions, frailty, and their care needs. And what this one does is it answers the question of how complex is the patient's overall health and care needs. And as you can see here, there's 8 different categories of categorizing your patients. We've then got the continuity of care model. And in here, you'll see that we've got both predicted and recorded status in here. So what this one does is it's a practical prioritization tool, which is sort of derived from a mix of different scores, utilization, and clinical judgment. This one is based on the Foundry model, and it looks at who should we actively protect continuity for. And in a minute, we will go through exactly what those categories look like. As we continue down the list, I noticed quite a few of you using the Johns Hopkins model. So for those that aren't aware of what it is, this is a utilization and risk modeling system that predicts future healthcare use. So who is most likely to use our care in the next 12 months. So again, as you can see, there's 11 different categories here that groups patients into different types of categories. We've then got Q admissions, so this is another predicted one. So this predicts the risk of emergency hospital admissions. You've got Q cancer, again predicting the risk a patient might have of developing cancer based on symptoms, demographics, and their history. You've then got Q risk. So with these ones, again, we've got a predicted model as well as a recorded model. And this one is based on cardiovascular risk. So the predicted model here will use an algorithm to calculate a patient's potential risk, whereas the recorded model works off the coding that is recorded in that patient's record. So that is a validated risk score for that patient. As we come down, last little bit on here is just to say that we do have a series of case finders available for the continuity of care model, because that one does require just a little bit more work, but we can touch on those a little bit later. So as you can see here, we've got lots and lots of different tools available. So if you wanted to use this as a starting point, so if you know which tool you want to use, for example, Bridges to Health, and you want to focus purely on your healthy patients or your acutely ill patients, you can come onto here, click that view button and start to use the tools from that perspective. Now, another good way to look at this is Charmaine mentioned about the other segmentation tools we've got. So those form part of the report breakdowns and they are available in all of our reports. So to show you what that looks like, I'm going to come back along the top here to the overview section. And scrolling down, I'm going to use my GMS active search. So this will show me all of the patients registered at my practice. I'm going to click that view button to break down that report. And again, this is a great place to start if you've got no idea what you're looking at. So come on to here, have a look through all the different insights and tools to decide a cohort of patients that you may want to focus on. So over to the right-hand side, so the right-hand half of the screen is where all that detailed analysis and various different tools live. Starting with your demographics tab. So in the demographics, you'll see that you've got an age breakdown in 10-year bands. We've got gender, ethnicity. You've got that core 20 plus model in here. And then you've got health deprivation and multiple deprivation. And if you don't know what is included in those categories, if you hover over the little information icon there, it will then give you a description as to what exactly it's measuring and looking at. Now, continuing along that list, I'm going to skip the map and I'll come back to that one. You've got conditions. So this one will provide you with that full condition breakdown of your patient. So that's quite useful for layering over any of your other tools. At the top, you'll see it gives you that sort of domain overview and that disease area. And then as you scroll down, we start breaking that down for you into each and every single long-term health condition. And that goes all the way down to the bottom for each and every one of those disease areas. Risk. So this is where those risk stratification tools live. So in here, you'll see that for any report that you click on and break down, you can then access which patients fall into these different tools. So you've got your bridges to health, continuity of care, and so on. As you scroll through the list, right the way down until you get to UCLP, which also sits on our condition dashboards as well. Now, jumping back to the map, just want to show you what that one looks like, because this provides you with geographical data of your patient. So rather than just looking at numbers on a report, with this one, you'll be able to see where these patients actually live in your area and looking for those areas of density, if you like. So with the map here, you'll see there's two different settings on it. It defaults to organisation postcode, and what this one does is it works with this benchmarking table here, basically pinning each one of those practices on the map. The darker the pin, the more patients are within that particular practice or organisation. If you click the drop-down menu on the map here, you'll see there's a second option, which is patient LSOA. So if you don't know what that is, think of it as postcodes. So all patients are allocated to a specific part of the map all across the country. And again, with this one, it's a heat map. So the idea is it shows you where the densities are in your area. The darker the colour, the more patients live within that section. So it gives you a good idea of where you may want to focus some of your projects. Now, when it comes to layering over any of these different insights, and we will take a deeper look into this, but as you start playing around with all these different tools to get to the cohorts of patients that you might want, so I'm just going to hop back to the risk tab there. You'll see that just above your benchmark table is that filter icon. So clicking on that one will allow you to start layering over any of these different tools that we've got. So you've got your demographics in here, and you'll see that for the map, when you click on address, you're also able to filter down by areas of that map. So whether that's your LSOA code, electoral wards, and so on. You've got that risk category. So again, with this one, we can then start to layer over any of these different tools, and exactly the same for your conditions. And with your conditions, if you pick the any option, that will include everything for that disease area, or you can be really prescriptive and select individual conditions on here. Just for demonstration purposes, what I'm going to do is just pick one of my risk categories here. So I'm going to go for my amber patients for continuity of care. Click apply. And you'll see that the whole dashboard now updates the view, showing me the insights just for that cohort of patients. So from a benchmarking perspective, you'll be able to see how many patients that applies to across your PCN or your area. And then in terms of the tools that we've got here, so we can see that I've selected the amber category. That's all it's showing for continuity of care, but I can now layer over other things. So for my bridges to health, I can see that the majority of these patients sit within the LTC part of bridges to health, or looking at some of the other ones, most of them fall into the lower risk admissions category. So quite quickly, you can start to define a cohort of patients and think about different kinds of projects that you might want to look at. And again, keep populating that filter with more and more criteria to get you a really detailed cohort of patients. So that's your population level risk. Just before we move on to look at some really specific examples, what I'm going to do is just come back to those registers there. Now, I'm sure some of you might wonder what makes a patient red for continuity of care, or what means that they fall into a different type of category. A useful tool for you there would be to have a look at the rules tab for the report. So as an example for you here, if we have a look at our continuity of care red patients, so the ones with complex needs, if you click that view button, On all of these reports, the very last tab on the right-hand side is the Rules tab. Now on here, you can then see really quickly what this report is measuring and looking at. So if we come to our rule number 2 here, we can see that this is looking for the red criteria. I can click on that one. And that will then show me that it's looking for patients who are severely frail, on the end of life registers, and they have multi-morbidity, so 5 or more long-term health conditions. Now, if we wanted to see which health conditions are considered, follow the hyperlink, and that will then start to break it down for you. So we can see that included in that is this whole list of conditions. And if you're really interested and wanted to keep following it through, by all means, keep clicking on these hyperlinks until you get to the code browser. Obviously, this is going to show a huge amount of coding because it's looking at lots of different diagnosis codes. But the idea here is that you can then see, so for our diabetes, there's 87 codes available. So if you were interested in looking exactly what it is that's picking up these patients, have a look at that Rules tab. So let's look at some specific examples. So you can use any one of our reports in here to start looking at particular projects. Now, I've picked 2 examples for today's webinar. I'm not saying you have to use these ones. It's just to kind of get you thinking and show you how you can apply these tools to existing reports. So for the first one, we're going to have a look at high frequency attenders. To do that, I'm going to click back onto my services menu, and I'm going to go to my appointments dashboard. This one will default to past appointments where we want to be. And as I said, we're going to start off by looking at high frequency attenders. So right at the top here, we've got 3 different reports available, 10, 20 and 40 plus appointments in the last 12 months. Now, this is a good starting point because it's a really great example of where raw activity data alone doesn't explain the need. So at this stage, all we know is we have 12 patients on my list here that have multiple appointments, but we don't know why. So we can start to break this down and have a look at what the data is telling us. So I'm just going to use my 20 plus appointments, and I'm going to click View. Now, working sort of from left to right, the things we can take into consideration here would be benchmarks, so you can have a look and see how your frequent attendance compares to some of the other practices around there. You'll have access to your patient list, and we'll take a look at that one shortly. But on the right-hand side, if we start to look at some of those risk considerations, we may want to have a look at demographics. So again, this one can show you for those key dynamics of the patients, what might be the drivers, because at this point in time, we can look at a patient list and we can see a load of names, but it's pretty meaningless unless you start looking at the reasons what might be driving this. So we could consider those demographics. You might have a look at the map. So again, looking at that patient LSOA feature, you can then see, is there a particular correlation here? Same with your conditions, and again with those risks. So some of the sort of tools that you may want to consider using here that could be quite useful. You've got things like your Johns Hopkins, so that can help us to understand whether high attendance reflects underlying clinical complexity and what that future demand might be. Your Bridges to Health could be good because that lets us see the type of complexity these patients are presenting with. So whether it's multimorbidities, frailty, mental health, those kinds of things. And then you can also combine it with something like your continuity of care RAG system. This is where your risk stratification becomes actionable. So patients in that red category are those that are most likely to benefit from continuity of care. So those are your complex patients. Now that you've kind of got your insights here, what we want to do is to consider staff level data, not to kind of pinpoint it in a certain direction necessarily, but to have an understanding of how the demand flows through your practice currently. And that way we can then match the right resource to the right need. So using that staff tab, you'll then be able to start to analyse who are these patients seeing. If you click those little arrows next to the roles, you'll then see exactly who the clinicians are that these patients are seeing, along with the numbers next to them. So that can start to help you to analyse exactly where the demand sits within your practice. Now, when we look at patients with high attendances, one useful lens is to look at who these patients are seeing. So this can help you to understand whether these contacts are primarily using your GP time or whether they're already being supported by the right resources within your team. Now, when you're looking at your high frequency attenders, generally there's two expected patterns here. So you've got your expected high need. So coming back to your risk tab here, if we think of our continuity of care model or any of the other ones that identify your complex patients. So the patients in the expected high need are exactly the patients we'd expect to be on these high frequency reports. People with complex multimorbidity, frailty, and significant mental health needs. For these patients, the high contact reflects a legitimate need. And the question here becomes whether continuity and proactive care can make their support more effective. So you're going to want to see who are these patients in those categories seeing, and can you make it better for them? What it can also highlight for you is a smaller group of patients whose contact patterns may suggest that their support isn't very well aligned to their needs. So an example of that would be repeated GP appointments that's maybe driven by social, practical, or well-being issues that could be better supported by social prescribing, care coordinators, or community services. So looking at the staff level contact, we can then see where GP time is being used for issues that might be better addressed by other parts of your multidisciplinary team, which then means that you can sort of safeguard that GP capacity for patients who genuinely need the medical input, but also making sure that you're still protecting the support that other patients may need, just aligning it a lot better. So again, some of the ways that you would do that, and we're now looking at targeting the particular cohorts. So using that filter, we can then decide which one of those cohorts we want to target. Is it our red patients, or is it perhaps our green patients who maybe could do with better alignment of their care? So pop those into your filter in here. So let's just go for our red patients for continuity of care. Click apply, and that will now give you 5 of my patients that meet that criteria. I appreciate this is all demo data. There's no real patients in here, so your numbers might be much, much larger than this. But this should give you that idea. So now that we've layered over the red filter, I can now have another look at my staff tab to see who are these 5 patients seeing. So they're seeing quite a lot of my GPs here, but I can see that they are also seeing community practitioners and so on. So very quickly, you can start to measure that level of demand. So now what we're going to do is set some targets and decide what we want to achieve here. Is it for our red patients, more proactive care, or are we looking to look at our green patients and send them in a different direction? Once you've decided what you want to do there, you can then access your patient list. So click on that patient button, and that will then give you the patients that you need to look at. Now, there's a couple of different ways you can use your patient list. You can either use the bulk export options, you can use the CSV file to bulk message them, or put the list of names back into your clinical system if you maybe need to send some letters or whatever need you've got there. But a useful tool that you can use, which is quite a new feature that we've got, is called the single patient view. And you'll notice just along the left to the right of the NHS numbers are these view buttons, and this will allow you to access that patient's single patient view. So if I click on this very first patient, that will then open up their view. And on here, what you'll find is this top section here will summarize all the different categories they fall under for the various different risk tools that we offer. You've also got these icons that show you what conditions the patient already have. So as a quick view, you get an understanding of who this patient is, what they might have, and what could potentially be driving some of these high frequency attendances. Now, with your single patient view, what this one does is it shows you every single report your patient is linked to in Ardens Manager. So on my overview, I can see that there's 89 work to do reports in here. Now, I know that sounds scary, but it's also a great thing because it can show you where the patient has lots and lots of work to do and where you can maximize your contact time in there. You can break that down by services or by contracts. So if you wanted to see whether they've got any QOF indicators outstanding, you can do that. But what I want to show you here, which makes it particularly helpful, is looking at things like allocated named GP. So focusing on our services here, if I start scrolling down the list, I can also search for it using the little search function there, but I can quickly see that this patient has lots of things outstanding that I can look at. But one of my first things to consider would be population level, recorded, their language, but also allocated name GP. This patient has a to-do box here, so that means this patient is continuity of care red and they have no allocated name GP. So that could be step one, to make sure that I'm actually allocating them someone who can be responsible for their care. And while I'm there, I can have a look at everything else that needs doing to try and improve that proactive care element there. Once you've decided what you want to do here, you've got quick access to the record in that top right-hand corner. So click that Open In button and that will launch the patient's record in your clinical system for you. So mine says EMIS, but if you're System 1, it will say System 1. So hopefully that will streamline the whole process for you and give you a much deeper insight into that patient to try and get you to decide where you want to improve their care. So coming back to our main dashboard, now that we've decided what we're going to do and we've got our list of patients, we want to have a look at targets and monitoring and recording some of our information here. So I'm going to click on my trend chart here, and now we're going to have a look at some targets. So I'm just going to turn off the per 1,000 count, so it shows me the raw count. And if you find that the orange and the yellow line gets a little bit distracting, you can always turn those off. They relate to your benchmarking table just to help you track some of your progress. Now that I've turned those off, we can see what my line of frequent attenders here is doing. So it's doing a little bit of a jump all over the place, but I can see that there's been a general increase here. And what I want to do is to drive down the amount of frequent attenders. So at the bottom of my chart here, I can click on Add Target and add in whatever my targets are. Here's one that I did earlier. So this top line here has made a new yellow dotted line on my chart. So that will now mean that I've got something visible that I can look at every time I am reviewing my data. Now we want to assign some responsibility to this. So using that Assign To bottom in the top right-hand corner, I can then assign responsible members of staff to this list. So you can have multiple people here, it's not just one. So assign whoever you need to assign to, and then you can use the little comments feature just next to that to document your actions, your outcomes, and whatever your targets might be. So again, you can click on that new button, you can now put in whatever your new actions are, and then as you're coming to review things, maybe you need to readjust your cohorts and whatever you're looking at, you can add some replies here, list what your outcomes are, and then everybody can stay up to date with everything that we are looking at here. You know, and just remember that you can keep coming back and reiterating your cohorts. If you find, if we look at my little chart here, I'm not making a huge amount of progress on mine because I want to be down to a level of 10. I'm nowhere near that at the moment. I can come back, reiterate, redefine my cohorts and see what that looks like. So that's a bit of an example of using high frequency attenders for you. Just before we look at the next example, just want to check in if there's any questions, Charmaine, that we need to bring to the main group.
Yeah, we just had a question come in to say that there is quite a few risk strat tools. There is, isn't there?
There
And
is, yeah.
how do we know which ones we should be using? Now, my instinct is saying that you should really be checking with your ICB just in case they are, if you think of areas such as South East London, they need to
Yeah.
use a particular tool, don't they? So would you
Yes, that's
suggest
right.
that in first instance, check with your ICB?
Yes, I would say in that first instance, check with the ICB. Check if there is no specific tool at ICB level, check with your PCN if there's specific tools that they want you to use. And if that still doesn't give you the answers that you need, then I guess it's applying your own judgment. I think, personally, risk stratification is such a subjective thing. I don't think there is a single right tool for you to use. And actually, in terms of the contractual side of this, the PCN DES doesn't require you to use every single tool or even a specific tool as such. All it wants you to do is to use risk stratification tools to identify particular parts of your population. So it's applying the appropriate risk tool. So I guess whatever you feel is the appropriate tool to use, apply it to a real problem, and then use those outputs to prioritize your continuity and proactive care. And I guess in some cases, it's probably some are easier than others. In the next example, we're going to take a look at cardiovascular risk. So naturally, you might look at something like Q risk because that's sort of a condition-based stratification tool. But I think it very much depends on the project you want to use. And so long as you can justify your actions and why you've chosen that tool, I think that's good enough and that's perfectly fine. So I
We're
hope that
covering
answers
all
that question.
And we're just covering all bases, aren't we? And
Yeah.
there was a load more that has been, which I've wrote down, which people are using, like Brave AI. There's so many out there. That's the problem.
Yeah.
So if you have suggested or if you have said that you've used something outside of this, we will feed it back to our development team to see if there is anything in the pipeline. So watch this space. Another good question before you move on, because I think this is useful for everyone, and you probably have said it, but just reminding everyone on a call, how often is this information updated?
Sorry, Charmaine, can you just repeat that again?
Yeah. How often is the reports updated, the data updated in the system?
Okay, great. So with your Ardens Manager, it's daily automatic uploads. So everything that you record in your system, we extract on a daily basis and just automatically upload it in here. So there's no running of reports or anything like that. So you can be safe in the knowledge that whenever you log in, it's fresh, up-to-date information all the time.
Perfect. Let's move to the next then.
Okie dokie. So our next one, we're looking at condition-based risk stratification. So I'm going to come back to services. I'm going to come to my condition dashboards, and I'm going to come to cardiovascular. And on here, I'm going to use the tabs to come to my hypertension dashboard. So for this one, what we are looking at here is predictive risk stratification. So identifying that future risk, not just the coded disease. So the report that we're going to be looking at, as I scroll down the screen here to my case finder section, because our case finders here are designed to show you patients who are possibly missing from your disease registers. And I'm going to use this particular report. So query hypertension, because the latest clinic BP is over the target and these patients haven't had ABPM or HBPM done. Now, what this is looking at is highlighting those patients who do not have an official diagnosis of hypertension, but their record indicates that they may have and needs further investigation. If we were looking at these patients just as they are here, they may appear to be relatively low risk because they haven't got any official diagnosis on there. But what we're going to do now is to layer over some of these different risk tools to give it more context. So I'm going to click on that view button to start breaking things down. Now, as I said about risk stratification tools is such a subjective thing, how do you know which ones to use? I've chosen to use QRisk3 for this one because it is looking specifically at cardiovascular risk. You can, of course, use any of these other ones that you want to. But if we scroll down to the page where we've got QRisk recorded and predicted. So you've got your two different models there. So your predicted one is looking at an algorithm for all these patients that will predict their risk, whereas the recorded is what is physically recorded in your clinical system right now. So I can see here that for my lowest risk category, I do have some patients in here, quite a lot of them, 191 of them. And there are also some lower numbers in the medium and high risk categories. And there's some that it's not suitable for. Now I can compare that to the recorded status. So I can see that for the recorded status, my numbers are much, much lower. And there is a significant amount of patients who doesn't have a score recorded at all. So you can use either one of these categories. I've just chosen to use the predicted model here. So that's what I'm going to start with. So I'm going to put that into my filter, into risk, key risk, the highest risk category. And I can now start to look at this information in more detail. So coming back down, there's my predicted patients. And of these ones that are predicted to be high risk, I can see that actually 10 of them have a recording in the medium category. And only 3 of them are recorded, and there's some more that are not. I may choose to overlay any of the other tools as well. So I know that one of the tools that the Network Des talks about is your Core 20 plus 5. So if we use the demographics tab, we can then see for our Core 20 plus 5, I've got some patients with 2 or more long-term health conditions. Some of them are in the drug and alcohol category, and there's quite a few of them in the deprived category here. So again, I can keep layering this over. So if I say demographics, let's look at Core 20 plus 5, and we're going to go to our IMD 3 category there. So again, we're following the same process as with the frequent attenders. We're looking through all this data, deciding which cohorts is it that we want to focus on here. Now that I've decided on this group of patients, again, I can access my patient list from here, and I can use the bulk export options, or I can just consult my single patient view. And I guess the idea with this one is that you're looking for this particular report at patients who may need to be diagnosed with hypertension. So there's going to be some form of intervention here where you need to bring them in. So to make every contact count, have a look at their single patient view to see what else do they need to do. It's that time of the year again, nearly the time for QOF year end. So I can see here that this patient still has a QOF indicator outstanding. As we scroll down, there might be some other bits and pieces from a services perspective. You can then see that there's lots of performance indicators outstanding for diabetes and so on. So definitely make use of this screen to really understand the patients and just improve the service as a whole by making every contact count. And don't forget that you can launch their records straight from here, so you can then have a look at more detailed consultations that have been held in the past, interrogate the record, and then make use of the templates we've got to support you with your consultation. So if you need to bring patients in for ABPM or to give them blood pressure monitoring diaries or anything, use those templates to support those consultations and guide your record entries on there. I'm going to close that one. And then again, use these tools. So looking at your trend chart, decide what is it that you want to do and to achieve with your product, with your project. Are we looking to reduce the number of undiagnosed patients? By how much? Are you looking to increase your register sizes? So whatever your outcomes are that you're hoping for, have a look on there, add some targets. So again, here's some that I did earlier. Let's turn that one off and then see. So this is quite a good example of using the trend chart actually, because I've set myself some targets here to almost halve my list of undiagnosed patients. Now I can see here about halfway through that my line has become stagnant and I'm not making any more progress. So that might indicate to me that I might have to relook at my cohorts and focus on expanding it, or maybe looking at a completely different cohort, or maybe even change the tool I've used to get some better outputs here. So whatever that is, remember that you can go back to any one of these tools to have a look at who's left on this list and use that filter populate it with as much criteria as you want to get to that real definitive outcome at the end there. So that was a bit of a quick tour of that particular example. So I think case finders are a really good way of starting, but hopefully those two have given you some thinking process as to how you want to continue with your risk stratification. Just before I hand you back to Charmaine, there's one thing I do want to show you, and that is to use the Network DES dashboard to record your outcomes on here. So going to your contracts menu, you'll see you've got your Network DES dashboard on here. And what we want to do is to jump straight to the tab that is for capacity and access. And what we want to get to is the organisational activity for your capacity and access support payment. Now, you still have to submit your evidence in the usual way to get paid, but recording it on here sort of gives you a base of sort of housing that information. And the good thing here is that if you are connected to your practices can see that you've done that. It's all above board. Everyone can see what the plan is. So what I'm going to do is just switch to PCN view, because you can only populate this as the PCN. So a little note here for anyone on the call today that if you are a member of lots of organisations, please make sure that you are logged in as your PCN account when you do this. All you need to do is to just click the plus add button here. Mine says edit because I've already populated this, but it will say add. And then in here, you'd be able to put all your information on here, your supporting evidence as to how you're meeting this particular criteria, what tools you've used, what projects you've done, and then mark it as complete or mark it in progress if you still want to come back to it. And that means that you've got all that evidence logged on your dashboard, your practices can see it, and you know that your evidence has been gathered for that indicator. So that is that part of the demo complete. So I'm really hoping that you found some value out of that and sort of have a starting point of where you may want to look at. Just before I hand you back to Charmaine, I just want to tell everyone that we have got this brand new feature out, which is our search function. And you'll see right at the top of any dashboard is the search bar, and this is a keyword search. So if you're ever curious and thinking, oh, I wonder if there's a report for this or if there's a dashboard for this, you would then be able to type in whatever you want and it will list for you dashboards, reports, contracts. You can even search for patients on here. So again, as an example, if I pop in an NHS number, that will give you the patient list. Let me just switch back to my practice view because I'm in PCN view. Let's pop that NHS number back in there. And that gives you that patient list with single patient view. So it's quick access to get to any of your reports that you want to look at. So I'm going to hand you back to Charmaine.
Yeah, before you switch your screen though, there's just a couple of questions if that's okay. I love that. I love that site search feature. So if you've not used it, use it already. If you are using it, just give us a reaction. It'd be good to understand if anyone is using it at the moment, but it's so super useful. Reactions are coming. We've had questions. So someone said, once you populate your cohort patient list, what do you do after?
So I guess that's subjective because it depends what your project is. So I suppose for the example that I used for query hypertension, because their clinical BP is over the target, that one is looking for patients who haven't then had an ambulatory blood pressure monitoring or home blood pressure. So as a first step, if it was me, I would then use that patient list to invite those patients to have ambulatory blood pressure monitoring or send them a home blood pressure diary and then wait for those results to come in, and whatever those results are would then dictate what your next move will be. So yeah, I'd say depends entirely on what reports you're using.
Okay, thank you. I'm going to share my screen. Remember, we have got time for questions at the end as well. So I'm just going to give you a quick top level talk about continuity of care that we mentioned at the very beginning of the webinar. So we do support you with this in your clinical system. It's the only one mainly that we do within your EMIS system and your System 1 system. All of the resources that I'm showing you is in your system right now. So if you decide that you do want to adapt continuity of care, you can go away straight away, you can do that. I'm going to get Georgina to share the support articles for both System 1 and EMIS, so you know exactly how you can implement it and just give you an overview of how you can use the resources. But starting with the templates, so you've got the templates that will be available within your clinical system. And when your clinicians launch these templates, it's giving them guidance on exactly what the status is for the patient right now. So this is the EMIS one on the left-hand side. This is the System 1 one. Both kind of work in the same way. So it's telling you exactly what the status is. And then if that clinician needs to update that status at all, then you've got the option there to be able to update it. So maybe the patient's gone from a green to an amber, or maybe they've gone from a red down to an amber. You'll be able to make those changes by using that template. So that's one resource that we have for continuity of care. Also, we have the patient alerts. So top is your EMIS ones. Bottom ones are your System 1 ones. And what they're doing is they're alerting, when you go into a patient record, it's basically alerting you to what the current status is for that patient, whether it's green, whether it's amber, whether it's red, or whether it's unknown. It will tell you all of that information. So for the EMIS practices, you'll find it in the pink QOF alert box, we normally call it, bottom right-hand corner. You can double click, I think you can double click on that alert and then it fires up the template for you if you do want to quickly change that status, maybe it's wrong or needs updating. And also, optionally, you can have this prompt here that when information is saved in the patient record, it will prompt up and say, look, this is the current status for the patient. Do you want to update it? And you can say yes to that. If you are an EMIS practice, you have to turn on all of the resources for continuity of care. So you have to, one person who's got access rights has to go into Resource Publisher and activate the alerts and activate the template. But we've got a support article which will walk you through how to do that. If you're a System 1 practice, you don't need to do that. It's all there ready for you to use. You'll find it in your demographic box. It will just give you an alert here. You've also got it on the patient home screen. You've got that patient status again, which will allow you to see exactly what status the patient has. And the statuses work, or the alerts work the exact same way any alert works that we provide you as part of Ardens. So that's System 1 practices. We also do have the reports. Now, if you want to go that step further to really manage your population, then definitely Ardens Manager is the right tool to be using for that. But we do also have reports for continuity of care within your clinical system, which you can use right now. EMIS up the top, System 1 down the bottom, but both folder structures are exactly the same. So we help you identify what your registers are currently looking at, like how many patients have been coded with red, amber or green. It's really important that these have to be coded within the clinical system. We also alert you to anyone we feel you should have a status of red, amber and green. So those are your predicted reports. It's looking at all of the criteria that meets that particular status, and it's saying to you, these patients haven't got that code in, should they have that code in? So if you want to do a bit of housekeeping initially to get it implemented, you may want to focus on your predicted reports, and that's again both available in both systems. Notice that we also have a review folder, so this will help you with just ongoing management to make sure that the statuses are kept up to date. And we also have data quality reports, which are quite good as well, because these will say, look, this patient's red, but should they be an amber? Or these patients are green, but should they be an amber patient or a red patient based on the criteria that's gone into their record? So it's worth, again, having a look at this. But remember, this is only data that's available within your practice, within your organisation. If you want to go a step further and look at it across organisations, then you need to be looking at Ardens Manager for that. And I think that brings us to the end, which we have nicely finished just on time. It's really now looking at next steps, and then we can revisit questions again. So we used a lot of Ardens Manager today. So if you are an Ardens Manager user, We recommend that you should have training every year, particularly with Ardens Manager, because it's always evolving all the time. So if you haven't had your training this year, get your training booked in. We've got a nice training catalogue, which we can send to you when you reach out to our training team, with a number of different courses that you can book your staff on. Remember, training is free. You can have as much training as you like. Just contact our training team. We've also got Ardens Academy as well. So if you do want to complete any online courses in your own time, you've got the link for Ardens Academy. So that's if you're already an existing Ardens customer, an existing Ardens Manager user. If you're an Ardens person, but you're not using Ardens Manager, then you can sign up for a free 1-month trial. And what that would do is it would give you access to everything that Mariette showed you today, all of our national dashboards as well. Perfect time to do that right now as we go to the end of the financial year. We're literally now on the last month, so it's really good for your QOF and your network contract there. So there's the information to sign up for a trial, but I'm going to get Georgina to post that information in the Q&A as well. We will also email out this information too, so you've got that. And that brings us to the end. I'm going to leave up this feedback QR code here. We always value your feedback on the content of the webinar, presenters, also the actual product itself. If you feel that there's any improvements that need to be made, that'd be brilliant. So just scan that QR code, that would take you to our feedback form, and if you can complete that, it won't take too long. So I'll leave that there. And why we do that, Mariette, should we just jump on again and just check to see if there are any questions? I mean, this brings us to the end of the webinar. So if you've got all of the information that you need, then please feel free to leave. It's just the red leave button, and just a thank you for anyone that does have to leave. Otherwise, we will stick around and answer any questions. So thanks very much. And just a note that our next webinar is going to be all around women's health. So if we will make sure that we send out details on how you can book onto that.